Thank you all very much for joining us today. My name is Liz Williams. I'm one of the workshop organizers, and I'm joining you from the Australian National University School of Cybernetics in Canberra, Australia. This session will work as follows. I'm going to call each panelist to the stage to present a 3-minute recap of their talk for you all. I'll then open up the floor for questions to everyone here. I'll ask that you hold all questions during the presentations, and I'll also note that we're recording this session for release to other SRA22 participants after the event. So if you don't wish to be on camera, please share your question in the chat. We will have someone monitoring the chat who will share your question for you. So first, I'd like to invite the first panelist to the virtual stage, Amir Asadi. His talk with collaborator me is titled Safe Human-Machine Collaboration in Healthcare, a Complex Adaptive System Perspective. Thank you very much, Amir.
Hello, everyone. I'm Amir, a PhD student at ANU's School of Cybernetics. And before we begin, I would like to acknowledge the traditional owners of the land on which I stand, the Ngunnawal and Ngambri people, and pay my respects to their elders, past and present. All right, my talk was focused on safe human-machine collaboration in healthcare from a complex adaptive systems perspective, and was prepared in collaboration with Dr. Liz Williams as my supervisor. This talk has 3 main elements: human-machine collaboration in healthcare, safety, and complex adaptive systems perspective. And I will try to quickly review each one of them. Advances in artificial intelligence, big data, and machine learning have enabled us to use AI-enabled systems in many areas of our lives and in many new ways. One of those new ways is called human-machine collaboration or human-machine teaming, in which a partnership between the human and the AI-enabled system is built to help each party bring their own strengths to the table in order to achieve a shared goal. Human-machine collaboration in healthcare specifically can be useful since it can reduce the level of workload and improve the quality of healthcare services. It is also believed that this form of work can be helpful in addressing the challenges related to the global shortage of healthcare professionals. However, there are still obstacles to overcome. One of these obstacles is ensuring the safety of these systems. Given the high degree of interconnectedness and complex interactions in healthcare systems, we believe that achieving safety in a shared response is a shared responsibility of all the stakeholders that are involved, and cannot be simply assigned to one party, such as developers or operators. So what are our options for addressing this challenge? One of the approaches that researchers have widely taken to address issues related to healthcare systems is using complexity science. Complexity science is a paradigm that studies complex adaptive systems, or CATS. These systems demonstrate properties such as adaptation, dynamic and nonlinear interactions, and emergence. By using complexity science, we can see how the different elements of a system work, and work to shape the whole and its outcomes. And also we can see how each element evolves over time. So this is like a starting point for my research as a PhD student, and I was hoping to hear what other people think about it and what questions they may have. I believe that to address the safety challenges for human-machine collaboration in healthcare, we can use complexity science, but it requires us to find a way to operationalize CAS theory for these systems, which I guess it's one of the biggest challenges that I am facing to take my research forward. Thank you.
Thank you so much, Amir. I'd now like to invite the next panelist to the stage, Meltem Öztürk. Her talk with collaborator Fatma Azara Haj Amar is titled Analyzing Human Development Index from Multi-Criteria Decision-Making Point of View. Thank you very much. Meltem?
Meltem, Meltem, we don't hear you.
Meltem?
Meltem, you're mute.
Is it okay now?
It's
Yes.
okay now.
Yeah, okay, sorry, because I forget that I muted the micro. Sorry, and can you see my slides? Is it okay also?
Yes,
Yeah.
we can see them.
Okay, so let's go. Up. So hello everyone, and thank you for this opportunity to talk about our work. So my name is Meltem Öztürk. I'm associate professor at Paris Dauphine University at LAMSAD. So Alexis was my advisor long time ago. And this work is done with Fatma Ezra Amar, and it was her internship project for her first year of master degree. So Fatma, she is now doing another internship in a bank, and for her second year of master degree. So that's why it's me who presented this work. So the idea of this work is is about indicators, because we have a lot of indicators. We are all the time using indicators like Human Development Index or air quality or biodiversity index or democracy index. So there are many indicators which are used for different issues and for policy makings also. And all these indicators are a little bit are aggregation of different dimensions. And since at LAMSAT we are working in multi-criteria decision making, where we do the same thing, meaning that aggregating different data and aggregating different preferences. So we say that, okay, we will analyze this type of indicators from our point of view. So from multi-criteria decision making. And we choose Human Development Index because it is a very well-known one, and it is very frequently used by politicians, by economics. So maybe you know this indicator. It is created by United Nations Development Program, and it is the aggregation of 3 dimensions: health, which is approximated by life expectancy; knowledge, which is approximated by expected and mean years of schooling; and also standard of living, which is approximated by GNI per capita. So, this is so you can go to their webpage and you have a lot of data. You have all the countries of the world with their ranking using Human Development Index, their score with this index, and also another information is about their classification, because they are doing also a classification of countries into 4 categories: very high human development, medium, and low one. So before showing you the aggregation, in multi-criteria, the first thing that we check is Pareto dominance. So Pareto dominance means that when I compare 2 countries, is it possible to have X better than Y in all the criteria? And if this is the case, I know that X is better than Y, and I don't need any aggregation. So this data set is very particular because 3/4 of the pairwise comparison that we can do are Pareto dominance. So I don't need an aggregation for them. I just need an aggregation for 1/4 of pairwise comparisons. And they do this using a geometric mean, this multiplication. And in order to have this geometric mean, we need values between 0 and 1, and they are doing a linear normalization using some minimum and maximum values. So what we did in our work, first of all, we analyzed these formulas, and then we wanted to check what may happen if we use other aggregation operators. So the first thing, for instance, they changed a lot of things in these indicators. So instead of using a geometric mean, if we use an arithmetic mean, what happens? Because they were doing this 13 years ago. So there is, within this data set, there is no big differences. So it's not very important between them. However, another modification that they've done is to change the way that they're normalize the GNI, because they are using a logarithmic function in order to say that if I add 100 euros in a poor or rich country, it doesn't mean the same thing. So they use a logarithmic one. So this is the blue one. But before they were using an Atkinson transformation, and you can see that here are my countries. So this is Norway, the most developed one. Here you have Niger, and you have also Australia between the 10 best countries, and you have the scores, and you see that even just changing the normalization for poor countries, I can double their score, which means that the score alone doesn't mean anything for this indicator. So there are other things that we do, but it is, so I don't have time. And we also checked the question of using other types of aggregation operator, for instance, one based on Pareto dominance. So Australia is the first country, the best one. If we use this, we test other operators which are rank dependent one. And another question that we ask is the following, and I want to insist on it. So here you have four categories. So when I will say my country, for instance, Turkey is in the best, very high human development country. If I ask the why, they will just say that, okay, because we use statistics, we use quartiles of distributions, and we checked that your country is like this. And I think that using statistics in order to say this is not a good idea, because you have to define what does it mean very high human development, and then after this definition, you have to see if countries are very well developed or not. And it is not this way that they do, but at LAMSAT, we are doing this type of softwares, and we checked, for instance, with Elect3 software in order to see if we used a real ordinal classification method, we will obtain or not the same categorization as a human development index, and the answer is no. So it is not a good answer. So in order to conclude, I think that I never understood why we need to rank countries. So I think that it is more important to give an intrinsic and meaningful evaluation for each country. And I think that the Human Development Index score alone is not very meaningful, because we can double it just changing the normalization. And we have a lot of Pareto dominance, and I think that we do not need to use statistics in order to define categories. And I hope that I show, yeah, with this study, we hope to show you that multi-criteria decision-making can be used for indicators and to analyze them also. So thank you. I hope that I wasn't so long.
That was great. Thank you very much, Meltem. I'd finally like to invite Lorenn Ruster to the stage. Lorenn is from the ANU School of Cybernetics, and her talk with collaborator Catherine Daniel is titled Algorithmic Impact Assessments, a Case for Moving Beyond Mitigating Harms.
Thanks, Liz, and hi, everyone, and welcome to this short overview of our talk. So as Liz mentioned, my name's Lorenn Ruster, and this is a joint contribution with Professor Catherine Daniel. And we'll be referring to algorithmic impacts as AIAs throughout this talk, and talking about moving beyond a case for just mitigating harms. I'd like to acknowledge that I'm currently speaking to you from the unceded lands of the Ngunnawal and Ngambri peoples in Canberra, Australia, and pay my respects to elders past and present. What I'm going to do in the next couple of minutes is give you a whirlwind tour through our talk to either jog your memory if you've already listened to it, or pique your interest enough for you to ask a question or listen to the full talk afterwards. And what our small study sets out to do is explore what impact means in currently available algorithmic impact assessments, and speculate on how the structure of these tools, in particular the ways in which they consider what impact is and what impact means, shapes our behaviour. So the starting premise of this work is that AIAs are objects that shape our behaviour. And the first thing that we did is look at a bunch of AIAs as per a recent Ada Lovelace Institute paper, and we dived into what impact means in these tools. And what we found is an oversimplification of what impact looks like. So, for example, a focus on negative impacts, that is on harms, a focus on first order or direct impacts, and a focus on standalone impacts. And then we took a step back and started to think about, well, there are other types of impact assessment that we could learn from, particularly in the responsible business area, which haven't been as discussed. So often environmental impacts or human rights-based impacts are discussed, but we wanted to expand that into looking at responsible business. So things like the B impact assessment or the future fit benchmark. And in these cases, what we see is an expanded notion of impact. So we see a focus not just on the positive impacts, but also on the negative impacts, but also on positive impacts. We see a focus and a recognition of not just direct impacts, but also ripple effect impacts, and not just standalone impacts, but also cumulative ones as well. And then using Dr. Jenny Davis's mechanisms and conditions framework of affordances, and this is a little analysis teaser here, we won't go into this now, we looked at how these artifacts might be shaping our behavior. And we speculate that focusing in on negative, direct and standalone impacts can fuel this sort of compliance-based mindsets. Whereas if we start to think about more expanded notions of impact, they encourage a move beyond just risk management to also encompass actions for wider responsibility. So this is obviously a very preliminary study and it's speculative. It raises a bunch of questions that we're keen to discuss. And those questions are things like, how might we shift notions of impact and practically reflect them in AIAs? Who might we need to engage to think about impact differently? And how can we ensure that AIAs are feasible for a range of organisations, from large government ones to community orgs and startups? And we look forward to discussing this and a few other things in the discussion that follows. Thank you very much.
Thank you so much, Lorenn. I'd now like to open up the floor for discussion. Kathy is going to be monitoring the chat if you have any questions there whatsoever. Otherwise, if you can use the raise hand gesture, I will happily call on you. And of course, the panelists are welcome to discuss what they've just heard from each other as well. Fred, you are welcome to ask your question.
Okay, well, 3 great talks. I enjoyed all of them. I enjoyed watching the presentations in advance. So my first question is from Meltem. Nice to see you. I especially enjoyed the discussion of indices and use of multi-criteria decision-making. I'm wondering if, with many indices, we don't use them necessarily to compare one country to another, but we use them to compare a country to itself, what kind of progress has been made. And I wonder if you've thought a little bit about that in terms of HDI. And that's where maybe statistics comes in, because you want to measure whether an improvement is statistically significant.
Yeah, I agree completely with you, Fred. I think that the comparison between 2 countries is not very important, but there are 2 comparisons which are, I think, meaningful. The first one, you said it, if I compare myself in the past, for instance, and so then I can evaluate the progress that I had, and I think that it's a good idea. And we can do it for Human Development Index because they give all the data that they used, so we can do it. We didn't do, but I think that it's possible to do. But the problem is that they say that they are all the time improving the way that they are doing, and they are all the time changing the normalizations or the aggregators or the minimum and maximum values. So you cannot just use the scores because your score is doubled. It doesn't mean that you are doing better now because they changed from Atkinson to logarithmic function. So if we want to do this type of things in order to compare myself to myself. I need to have all the time the same aggregators, the same normalization, etc. But we can do it. We didn't do it, but it's a good idea. I think another comparison that I think that it's meaningful is to compare countries to some prototype that experts can define. For instance, some prototype of low development country or very high development country, and then I can compare myself to these profiles in order to say that if I'm very well developed or not. So is it okay for you, my answer?
Yes, no, that's great.
Okay.
Wonderful. You had your hand up. Did you want to ask a question as well? Meltem?
Yes, I have a question for Amir. I have also another one, but let's start with Amir. I saw also your video, and all the time I'm saying, okay, the safety is a very umbrella term. You know, you can put everything in safety. So what does it mean for you? For instance, the use of data is a big issue, but it is not about, I think that you can maybe also be more safer if you have a good connections, but you need more things. So what do you mean with safety?
Great question. But I didn't define safety in my presentation, and that had a reason, because based on the perspective and the lens that you use, that may be different. So originally researchers, safety researchers and experts referred to safety as prevention of hazards and harm. But this new lens of safety is coming into the discussion about they are labeled as safety 2 or safety differently, which is amplifying the positive side. And it's similar to Lorenn's impact analysis and the positive and negative. So the definition of safety will be really based on what lens you will take. And in complexity theory, that the approaches that have taken the complexity theory have provided new definitions for safety, which has led to the new approaches to achieve that safety. I know I didn't answer your question because I don't have a specific definition for safety at this point, but that is something that will be hopefully clarified along the way.
So is it the safety for users?
Not specifically. So it's based on what do you mean by users? So we have the operators that use an AI-enabled system in the patient, you mean?
Yeah.
No, it's not specifically for the patient. It is also for the people who use that system, for the operators as well, because they are part of the system. And we have seen examples that in clinical decision making, the overload and the burden that the user of the AI-enabled system goes through is much more than they can handle, and that could lead to unwanted consequences. So it's not only for patients that taking the systems is kind of we are kind of hoping that to include everyone into that discussion that is related to the safety of that system.
Okay. Thank you.
I see a question from Alexis.
Yes, it is a remark and a question. Now, when we talk about impacts, indexes, indicators, the topics you were talking about, there are three different notions we have to mobilize. One is the notion of meaningfulness, which means that whatever we manipulate, in order to obtain this information needs to fulfill a number of formal requirements. There is another notion of usefulness. So it has to be something that makes sense for the decision process for which these indicators are used. And there is a third notion, which is the one of legitimacy. So this information needs to be legitimated and needs to generate legitimacy. Okay. Now, if I reason in terms of usefulness, no, which is the reason of my question, no, we should pay attention to the fact that designing an impact or an information for somebody, which means that it is useful for somebody, makes it useless for somebody else. There is no way that we can design an information, no, an indicator, which is useful for everybody. No? And we have several examples of how this works. We can have meaningful manipulation of the information, so meaningful indicators, which are useful for something and useless for something else. And usually these are incompatible. No? So I was asking the three of you, how do you think this can be handled?
Thank you, Alexis.
I'm not sure that I understood well your idea of to be useful or not. Because for instance, for indicators, when you developed an indicator, normally you think that, for instance, for Human Development Index or for Shanghai ranking, okay, the university ranking. So when you do this type of things, when you are creating, you think that X and Y will use it, but in generally indicators, there are many other people who start to use them, and then it's a little bit difficult to imagine all the people who can use it, and they can use it and how they can use it. So it's not so easy, but I didn't understand what you mean about that when it is useful for.
Let me give an example. The pollution index, no, at least in France, no, is the maximum of 4 pollutants. No, so you have 4 digits, and you take the worst of the 4, which is the bigger one. Okay. Now the reason for which this is done, it is because the use of this index, no, is for alert. So in case one of the 4 pollutants goes beyond a threshold, there is an alert to the young, the elders, the babies, etc. No? But if you try to use this index in order to assess whether a policy of improving air quality was successful or not, you will totally fail.
Yes, because it is not done for this.
Because it has not been designed for that, and it will deliver an information which is totally counterintuitive. Okay, so this is a typical example that designing an information, no, for somebody, it is useful for somebody, but it will be useless for somebody else. And typically, the requirements, the specifications that you will have from different groups are incompatible. No, which means, for instance, that if you want to measure safety, you need to say safety for somebody.
Yeah, for somebody.
There will never exist. There will never exist safety, generally speaking. And the same for the impacts. It is the impact for somebody and for some purpose, no, but not generally speaking.
Yeah, that's true. For instance, for Human Development Index, they just use the mean. So if you want to use it in order to see if your laws are good, it's not a good thing, because you can have a very, very heterogeneous distribution on your population, very rich people and very poor people, and you will have also a good, maybe average value. So it is not good, for instance, for this type of thing. So you have to know what it means, and you have to know who will use them and why they will use them. But as I said, I think that when you create an indicator, it is so easy to use, because you have a score up, you will just see if France is better than Australia, and you are happy. and it's done. So everybody will use it, and it is very hard to imagine all the people so they will use and etc. So it's a hard work, I think. But okay, maybe Amir and Lorenn want to say something.
Yes, I'm just thinking about some of the parallels between your talk, Meltem, in terms of the indexes and what Alexis was just talking about with impact assessments, because there's also a desire, at least, to begin to standardize how impacts are assessed, so that you can do similar sorts of benchmarking either within an organization or across organizations. So I think there are some interesting parallels. Obviously, it's a much earlier phase of that evolution process compared to, say, the indexes that would, like the HDI index. But I suppose one of the questions that I have in looking at the algorithmic impact assessments is to what extent they get set in stone early on, and who gets to decide on what is factored into the impact assessment. Because once it starts to get some momentum, and as you're saying before, Meltem, like lots of people start using it for different reasons because it's there and it's tangible, then it builds its own momentum, and it can become difficult to kind of undo or, you know, rethink what's in and what's out. So I do see, in the case of algorithmic impact assessments, they're sort of building on what's happened before, particularly in terms of environmental impact assessments or human rights-based impact assessments as a starting point. And then I suppose some of the questions that we're trying to ask with this work is, well, maybe there are other types of impact assessments that also could shed something interesting that to be incorporated while it's still new enough to trial. And I think the other thing that came up for me, Alexis, with your comments was around this legitimacy point that you're making, because I think with impact assessments, this is also like a core driving factor, is that, you know, if you've done an impact assessment, then, you know, you're thinking ahead and you're legitimating like the processes that you're going through as an organization and showing, like signaling some sort of maturity as an organization. And then I was thinking a lot about how, well, that can also be a real danger because, you know, it's only one snapshot in time, and but the system around you is changing all the time, which I think is then connected to Amir's complex adaptive systems approach of, you know, the use of time in how we use these tools to legitimate. So I'm curious around, for Amir, that concept of time in complex adaptive systems and how that interacts with safety, how that sort of changes maybe our conception of safety. Have you got thoughts to share on that one, Amir?
Yeah, sure. Can I answer Alexis first? And then,
yeah.
So I completely agree with Alexi about the idea of using a definition for the purpose, like attaching those two together, not to define something and then use it for every kind of application. And I'm sorry if I was unclear, but I have not defined safety at this point for my work, because I think like I have to find the correct boundary around the system that I want to analyze. So that's one part of the research that I need data for at this point, because like I can start by looking at only the human and the AI-enabled systems as a human collaboration setting, and look at that as a complex adaptive system. I can take a step back and look at the organization or the hospital that setting has been set up, or look at the whole healthcare system. So I guess based on the boundaries that we draw, the definition of the safety will be different. So that's why I hope to like go to the next step and gather some data and then decide on what will be the most appropriate definition for the safety in my research. And coming back to your question, Lorenn, about the impact of time on safety. So the one important thing that has been embedded into complexity theory and science is the idea of evolution of systems. So systems are not captured in one point at time. We take into account their evolution and their changes in and adaptation over time. So I know this is very ideal, but the ideal point is to define safety for different stages and different life cycles of a system, at least, like if we want to have discrete points to define safety for each life cycle. But again, this is something that bringing into application and operationalizing is very complicated, and I'm just at the starting point. But that's my ideal goal to do this for while considering the evolution of these systems. I hope that answered your question.
Thank you, Amir. We've got a couple of questions in the chat, so I'm going to go ahead and ask the first one now. This is from Ned, and it's a question for Lorenn. Do you plan to empirically test your hypotheses about AIAs?
I'm not sure yet, but if I was going to take this work further from here, then it would likely be within the context of like smaller organizations. A lot of these AIAs are developed for, in the context of government institution or in the context of quite large organizations. So they assume a lot of resources. And my PhD is actually really focused on the role of entrepreneurs in the broader ecosystem. So a question that I'm carrying is how you might be able to translate what some of these impact assessments do in that context. And I suppose in that sense, empirically, you could potentially test how the presence of an AIA in that context changes behavior, or what it then catalyzes in terms of the broader systems dynamics in an entrepreneurial sense. So that would be, I haven't planned to do that quite yet, but that could be something that emerges in my research going forward. Yes.
Wonderful. Thank you, Lorenn. I have quite a few questions from Tom. The general question he has for all of you is, what's the difference between positive and negative? So for example, a positive, in the case of an HDI score or safety or algorithmic impact, like, does it depend on what you define as neutral or base case or counterfactual or ideal? I see nods. Would somebody like to start?
I'll maybe start. So I think in the case of algorithmic impact assessments, often they focus on framing in terms of harms. So there is an assumed that there is some neutral state that is being made worse by the introduction of the algorithm. So what that neutral state is isn't often explicitly asked. So I think that's an interesting question. And I suppose the second part of that for looking at the AIAs is like the questions that do get asked then shape like what types of impacts you're looking for. So when they're framed as risks, then we talk about them as risks. And there's one interesting example of a more recent AIA, which a lot of them talk about, harms and things that could go wrong, worst case scenarios, but also now this sort of introduction or beginning to introduce rhetoric around, well, what could go right? Like, what's the best case scenario that you could enable? And so that changes the conversation. But it is an interesting point about taking a snapshot of what the baseline is, and obviously that would be fraught with challenges around similar things we were talking about before, like who gets to define what the baseline is and from whose perspective. So yeah, you can imagine a range of challenges with doing that. So it's an interesting point. Thanks for that, Tom.
Alexis, did you have a quick follow-up question to that?
To add something about this notion of negative impact. First of all, this is a notion that already exists in value theory. In 1969, Nicolas Rescher introduced the notion of bipolar value scales, which has a 0 point, which is a neutral point, just to show that the positive impact has a shape which is different from the negative impact. So the function that measures the impacts is different from 0 to 1 and from 0 to -1 if -1 is the negative, let's say, impact. No, this has also been discussed by Kahneman and Tversky in prospect theory, in which you have the negative impacts and which are perceived differently from the positive impact. So things that could have a positive consequence and a negative one. So this is an old concept in assessment. Generally speaking, if we distinguish the two dimensions of what could be perceived as positive or as negative, no, we have a space, a bidimensional space, no, in which we represent the consequences, no, as a pair, no, as of impacts, let's call them, which might be measured now by different formulas. I'm not going to spend more time on that. It's complicated formal issue on how we do that, but it formally exists since a long time. And people that may want to know more about it, you can ask. Meltem also knows a lot about that. So
yeah, generally, so in order to complete Alexis and also to answer, but in other answers, you already have some important things. So we need neutral or reference points. So generally, it is hard to talk about positive and negative values because what doesn't mean a 0. So you have to put the 0 and then you will see if you have a positive or a negative impact and this type of things. And it is not so easy. So for people who are doing this type of things in a formal way, there are some like machine learning methods it's not a real machine learning methods, but what we do is that we work with experts, because I cannot answer for education or for health because I'm not expert. So I have to work with experts, and then we ask some questions to experts, saying that if you prefer A to B, B to C, etc. And then all those informations are like some examples. And then we can use these examples in linear programs or other things, other algorithms, in order to see if they have a neutral point and what are the positive values, what are the negative values, etc. So there are some people in computer science, they are trying to do this type of things, but it's, yeah, so it's not so sure that it works very well, but it's a current and actual research domain. So
Thank you, Meltem. Amir, did you have?
Yeah, in relation to Tom's question about neutral, I think the impact of context is also very important. So I was thinking about my context, which is in healthcare, and I'm not sure if I can find a point that we can call neutral. Everything in healthcare usually should be on the safe side, and then if it's not safe, it's unsafe. And so I'm saying this as not an expert in this area. I'm not sure about that, but when I think about it, that's the only thing that comes to my mind. So maybe the role of context is here is important as well.
Excellent. That brings me to the question in the chat from Magali. How can the context be captured and presented or preserved, whether in the safety, impact, or statistics?
I see Lorenn is unmuted. Did you want to go?
No, you go, Amir. I forgot to remute.
Yeah, I think in my case, by looking at the whole system and taking the complex adaptive systems perspective, I try to capture what context the impacts of context on the evaluation that we will explore. So I think that's the way I will be doing that. I'm not sure if that answers your question. I'm not sure if I fully understood it. Sorry. I hope that was enough.
That's okay. That's lovely, Amir. And I might go to Fred now because he's had his hand up for a little while.
Okay, well, so there's another piece to this that we haven't talked about, and maybe this is for all three of the speakers. Impacts can be in the short term or in the long term or in the intermediate term. And so, for instance, if it starts to rain and there's been a drought, you as a farmer are very happy. The impact is very positive. But if that rain continues and continues, all of a sudden, the impact is negative. So could the three of you address that aspect, so the temporal aspect of impact? So safety could be improved in the short term and not helped in the long term, et cetera, et cetera. So.
Thank you. And I'm going to note we have 2 minutes left of this session, so we can start the conversation.
That's the idea.
Yeah, this is exactly one of the things that we found by looking at other types of impact assessments, was that some, particularly in social impact assessments, look at cumulative impacts. So they don't just look at what's happening when they do the impact assessment, but how it builds on the impacts that happened before and try to project forward. So I think that 100% this gets neglected because it's difficult to try and connect the dots sometimes, and people prefer to just deal with the concrete in front of them. But understanding what they call cumulative impacts or impacts over time in a longer time frame is certainly something that would be interesting to include. In the long run, we're all dead. Thanks for that, Tom.
Any other final comments in our last minute?
No, it's a hard question. Hard question for indicators. I don't know. Yeah.
Well, with that, I might recommend that we continue thinking about this, and we'll think on your question, Fred. That was a nice way to end because we'll all have something to ponder. I'm going to go ahead and close the section now. I want to thank all of our panelists for the excellent presentations and for their participation today. And thank you all for your questions.